Ladies and gentlemen, our next speaker for this morning is Dr. Thomas Colpitts. Dr. Thomas Colpitts received his dental degree from Washington University Dental School and his IMD at Capital University of Integrative Medicine, where he was Professor Emeritus. Dr. Colpitts is a member of the IAOMT and has a private practice in Tulsa, Oklahoma. Please welcome to the podium Dr. Colpitts.
So what I'm going to be talking about today is the three-dimensional CAT scan. I've been in practice for almost 40 years. This is probably the most important technological tool that I have seen since I've been in practice. It virtually changes the way that I look at patients, and it helps us find things that I couldn't see before. So I asked Rich, I said, you know, this is pretty important. I would love to be able to do a small presentation. Part of the problem we're dealing with now is that there are two things I'm going to do. One, I'll go through a PowerPoint presentation talking a little bit about the technology, a little bit about what it can do, some case studies, and then when we're done with that, I'll be able to pull up actually a CAT scan on the computer, and I can go through and show you how you can manipulate it, what you can do with it, maybe. So one of the things that I'll talk about here, and I'll go ahead and just address that for a few minutes, which is, you know, this is just a tool, and it gives us one piece of the puzzle. It in and of itself is not going to make us great biologic dentists, but it is going to give us a tool that's unsurpassed. One of the things that I always worry about is how do we document in the standard of care what we know is true, and I struggled with that for a long time, which is there are things that I knew inherently were a problem as far as infections are concerned, but I sometimes thought, okay, I know it's here, but I can't really document it if I want to take that to the Board of Governors or for the State Dental Board. And so how do I practice still staying within the standard of care? Somehow I was able to do that. I've never had a conflict with the board since I've been in practice. But this kind of relieves that. One of the things that we'll talk about is what's interesting is I virtually don't see, and I'll mention this, but obviously we're going to have to do something till we get the computer working, but I have seen one dental patient who came in with cancer in the last 15 years that didn't have significant dental treatment that was done. Do you think that's a coincidence? I don't think that's a coincidence. I studied a lot with Dr. Omura, who's an MD, and his belief is that all disease, including cancer, is simply an infection. Well, if that's true, and I started studying with him 15 years ago, that still seems true to me. I have not seen anything to tell me that that's not true. So if that's true, then one of the things that we need to do is to find, you know, where is the infection and what's going on. And the CAT scan is just an incredible tool to do that. I don't know how much technological tools you have in your office, but I've got a bunch. We have a CERAC and we have the CAT scan, and this is kind of typical. You know, every week something goes down and you're fooling with it and try to get it to work. But in fact, I was telling somebody, they said, "Are you a little nervous about speaking?" And I said, "Well, you know, a little bit, but you know, what you really worry about is, you know, the darn electronic stuff. Is it going to work or not work?" So right now it's not working. All right, so this is what we're going to talk about today. It's a little bit small picture that surprises me, but That's what it is. This is what we're going to talk about today. I'm a clinician, not really a scientist, but this is what I've seen. This is a great book. I used to teach practice management for a little bit, and I've always been kind of intrigued with it. This is a very interesting book by Jim Collins on companies that went from good to great. And you know, we're a company if we run a private practice, and he talks about passions. You know, if you're running a company, what are you passionate about? So I thought it's worthwhile to let me introduce myself a little bit. What am I passionate about? Well, I'm passionate about my family, and this is my family in Colorado where we rode horses, and it always seems funny to me. I live on a ranch, and we have 11 horses, but you got to go to Colorado to get everybody together on a horse. These are 8 of our grandchildren. You know, at the point in my life, there's not a week goes by that I don't think that I'm blessed, that I got to see my children grow up and my grandchildren grow up. Faith is important to me. Country is very important to me. I fly the American flag. Toby Keith, I hope you guys know Toby Keith, you should, he's an Oklahoma boy. And in his song, Red, White, and Blue, he says, my daddy was in the Army, he lost his right eye, flies the flag in the yard till the day that he died. Well, I fly the American flag, the Marine Corps flag, and you can't see it very well, it's the POW flag. The POW flag, I was not a POW, but I served in Vietnam, and it reminds me humbly that there are always people that pay more than I have paid, whether it be in dentistry or for the country or whatever. We just went to New York City this week. We just got in yesterday. Actually, it's my wife's birthday today, and part of my family, and she's part of the reason that I'm here and doing what I do because she supports me. But the Statue of Liberty really reminds me, I've traveled to every continent except one, and I've seen people who never had a chance. Those of us that are here are blessed that we are born with an opportunity. I don't care how smart you are, how motivated you are. If you're born in a situation, like a lot of people are in some countries, the most they can hope for is just survival, and many of them don't do that. This is a flag that flew in a little base that I was in Vietnam. The ranch is a big part of our life. We've only been on the ranch about 10 years, but I've learned a lot about physiology, and I've learned a lot about medicine at the ranch. This is one of our Clydesdales and little POA called Mac, and Mac almost died from arsenic mercury poisoning, and that's another story. But these are some of the things that I've learned on the ranch, and I think they apply to what we're going to talk about in a little bit. One, soil is a living organism. Stress on animals and health. I studied with one of the best animal movers in the world, Bud Williams, 80 years old. He taught us how to move animals gently without stress. Now, why is that important? When he took over a feedlot in Canada the year before, the vet bill and the pharmaceutical bill was $130,000. Within 1 year, that same bill was $15,000. What did he do? All he did is took the stress off the animals. If they came in and they were depressed, got them up and got them walking. If they came in and they were hyper, he got them walking and calmed them down. You know, I often think, what's the relationship for us as humans? Stress, a lot. And I could be better about getting stress out of my life sometimes, but I've learned a lot. Life and death. I've helped birth cattle, goats. I've buried a lot of them. Our burial's above ground, but we have a place where we take them to their happy hunting ground. So I've really learned a lot emotionally about this life cycle that all animals are in. There are holistic ranchers and farmers that are out there. The Stockman grass farmers are a great source for that. This is me just a month ago looking at, we raise Red Angus grass-fed beef, past organic. This is me and one of our guard dogs. Guards our house. He doesn't really guard much of anything else. This is where we actually package. We just got this part of this facility enlarged. This is the couple of guys are getting our grass-fed beef ready to take for sale. Okay, staff sometimes say to me, all right, tell them the goat story. All right, so you guys get the goat story. Goats have a problem with parasites. They're not really designed to come to Oklahoma and live in 200 acres, which is what we have them on. They're designed to live over hundreds or thousands of acres. Once the goat gets parasitic infection and you don't catch it early, I've seen many times when I go to a goat, I'll see the goat lying on the ground, and I go and it can't get up or it can't walk. And I thought, not a problem. I will take it in the stall and I will give it my natural medicine and I will do all these things. Never had a single one survive. And yet they looked really healthy last week. What happens is the parasites finally destroy so many red blood cells that they're so anemic. The only way you can tell is you pull their eyelid down and look at their gums, and if they're very pale, you know they're in trouble. We worked goats 2 weeks ago, and now we have a smaller herd, about 60 animals, and so we're trying to find it, and we've really got our herd doing very well. And the other thing, to go back to the cattle, we do not do vaccinations. We never give them antibiotics, and our herd is healthy. Hello. So this is one of our goats. We're out there with our goats, and this is one of our guard dogs. The guard dog stays out there and lives with the goats 24/7. Kind of a neat guy. Biologic practice, one of the things that I'm obviously, passionate about, and sometimes unfortunately I feel like I'm obsessed with. And my wife has been a great example of trying to, without criticizing, showing me how maybe to balance my life a little bit better with the other things that I do. But that, like you, I scheduled my parents' funeral on a Saturday so I wouldn't have to cancel patients. Now, if that's not ridiculous, you tell me it, but it is. The Outliers is a great book. It talks about people that are successful. He talks about the 10,000 hours. Everybody that's really successful he's found, had to put in their 10,000 hours. And that's why we're all here. We're putting in our 10,000 hours. Even the Beatles. The Beatles played in a bar in Frankfurt, Germany, 7 nights a week, 8 hours a night. Put in their 10,000 hours. Mozart, he put his 10,000 hours in starting at age 3. I wasn't quite that gifted. This is the CAT scan that I'm looking at my office. If you decide to get one, and I hope you do, one of the things I didn't say is I have no financial interest in any CAT scan, any company. I have a Sirona Galileos, but I'm not here to promote the brand of CAT scan I have. If this is something, when I'm done, that you think would interest you, do some research, talk to me, I'd be happy. I looked at it, I thought carefully 2 years ago. Things are going to change, but I'm not here to promote a particular brand, whether you buy a Ford or a Chevy, doesn't matter to me. We do a lot of nutritional testing. All these slides are a little screwed up, aren't they? Well, that's the way it is. Objectives for today, why do I have a cone beam? What is a 3D CAT scan? What can it do for you? Some clinical cases, and at least my opinion of the financial advantages or problems or benefits from this. Why did I purchase a CAT scan? 2 years ago, in January, I had a physician sent me a patient with cancer. The patient was on the way to Germany for cancer treatment, and the physician said, make sure there are no infections. State of the art, I thought. So I took full mouth digital x-rays. I looked a mouthful of PFMs and didn't like that, but didn't see any infections, didn't see that part of it. I had just heard about three-dimensional CAT scan about a month ago, and I mentioned to this couple, I said, there's one CAT scan in Oklahoma that you may be interested in. Well, they jumped on it and went and got the three-dimensional CAT scan, and the doctor called me and said, oh, there are 3 abscessed teeth. And I said, get out of here. Went back and looked at my digital x-rays, still didn't see them. So it then became a moral issue for me. Okay, if I have patients come in, and particularly if they're referred by a good naturopathic physician or a holistic physician, and they say, get rid of the infections, and I know in my heart and also intellectually that there's a tool out there that's better than what I have, you know, I was stuck. So I moved on it, and within 3 months we had one at the office, and of course they're expensive. From a business perspective, this goes back to Jim Collins' book, and he talks about the hedgehog concept, and it's based on the essay by Isaiah Berlin. And the fox knows many things, but the hedgehog knows one big thing. And I would like to think that we at the IAOMT look at health like the hedgehog. As biologic dentists, we go by the concept of trying to see the whole body. The head and neck is part of the whole. Freud, Darwin, Einstein, Adam Smith were considered hedgehogs. So even though it may seem to be, you know, simple, it's not really. And he had a model to kind of like you look at it, and these 3 spheres, and in the center, the black area is what, okay, that's cool, is the area that he calls the hedgehog concept. You know, that area there. So what are you deeply passionate about? And this is for companies, this isn't for us. What can you be the best in the world at? And those are his words, and I think, okay, well maybe that's intimidating, but at least what can you be great at? And what drives your economic engine? Now he talks about technology, and I think that's important because he says technology can become an accelerator of momentum, but not a creator of it. And so I thought that was important to talk to this group about, because I'm not here to tell you that if you get a CAT scan, you now are a biologic dentist and you've got all the answers. But the technology is important. And he goes on to say, does the technology fit directly with your hedgehog concept? If it does, then you need to become a pioneer in it. And I think that's true. My hedgehog concepts get rid of mercury, eliminate infection, reduce or eliminate metals, do excellent dentistry, and complement the dentistry with physiologic support. You know, I've spent a lot of time looking at the whole body. You know, I've spent the time with Dietrich and Dr. O'Meara, and I went for almost 10 years of spending at least 40 days a year in CE. And you guys are the exception, but you also know that the average dentist in this country gets 1 day of CE a year. The 3D CAT scan, as I see, it's the state of the art for detecting infection today. Okay, 10 years from now, maybe something else. It shows us what we already knew about root canal therapy, protects us from legal board problems, and you can see I've got some question marks there. I mean, who knows what your boards are going to do, but I firmly believe that with the technology, it's going to give us a leg up and an advantage in dealing with anybody that comes in and say, why did you do this? I did this because I have hard evidence that this is a problem. It absolutely creates more dentistry. If you find problems and the patients see the problem, then they want to do something about it almost always. It's from a practice management point of view, it sets us apart as a state of the art, and it does a lot more. This is the traditional CAT scan that we're all somewhat familiar with. How does it work? A single rotation, similar to a panoramic film, cone-shaped beam, 85 kilovolts. In the Sirona, they claim to have less than that than some of the other manufacturers. This is what it looks like. Looks very similar to a panoramic unit, so it's not like your patients come in and think, oh gosh, you know, this is way scary. You know, patients can stand up in it, or you can sit down if it's a wheelchair, they can look at that. This is the traditional medical model of the cone beam of the CAT scan. Obviously, we're going to try to get slices. The dental 3D uses a cone-shaped beam and captures the entire area in a single rotation. A little bit of a difference between the hospital CAT scan and the dental cone beam. You can tell, full body and a maxillofacial. And there have been some people that are concerned, well, what if I show up with a brain lesion? They're almost all designed to not include the brain, to only include those areas that we're licensed to practice and to diagnose in. Patient radiation dose is pretty insignificant. The Galloway, the one that I use, is 1.6 times the normal or traditional panoramic film. Radiation dose, these clinical results can be achieved with very low radiation dose to the patient. This high resolution scan is equivalent to 5 to 9 days of background radiation. This is the radiation that we all are absorbing every day. Galloway's 3D represents the lowest dose, 29 microsieverts of systems made for dental, 1 to 8% of the maxillofacial CAT scan. The low dose and high image resolution is possible due to the Siemens image intensifier employed as the capture technology. So you can tell that's it's something from the company. And again, I'm not pushing this brand. I think when you look at what I go through later, if it's something you're interested in, really get out there and do your own research. The reason I bought this one are two major things, three really. One is it had the lowest radiation dose, and I think that's significant. It was judged clinically by university studies to have the clearest image, and it has a lot of potential to connect with the CERAC system, which I have in the office and use. This just talks about the radiation dose, and the ionizing radiation exposure to the public is on this one. All right, now we're going to get to the good stuff. This is what I see: infections, and this is a big part. Now, implants are probably the biggest reasons that the 3D CAT scans are being sold. That's not why I bought one. It still has some deals. All right, this is me in our fire truck on the ranch that we keep to put out brush fires when we're burning brush. I think of CAT scan, and you have to ask Malika and Harris. They have kind of great memories of a late night adventure out on the country roads with the sirens going and the whistle blowing, and I think this was after some Maker's Mark, but we won't go there. Dr. Omura, I've spent about 15 years studying with him. He's an MD, developed the O-ring technique, PhD in acupuncture. He's also a Qigong master, oncology residency from Columbia University. We set up a series of lectures or sessions with him, apart from the ones he did in New York. He does a lot in New York for physicians, but that's usually centered around cancer. And there were about 20 of us that were dentists that spent, I ended up going about 20 weekends. And it was basically about infection. How do we diagnose and treat infections? But I also saw almost every weekend I was there, he would bring in, or somebody would call and bring in a cancer patient. So I saw a lot of that. The take home for me, now this is, maybe not his exact words, but this is what I got. Almost all disease, including cancer, is caused by an infection with a heavy metal component. That's what I saw. That's what I still see. This is one of my first cases after I got the CAT scan. It's a 24-year-old female. Her mother said she spent $20,000 looking for a diagnosis. She had severe pain. I used to do a lot of temporomandibular joint treatment. Also, it's not a TMJ problem. I did a CAT scan. I thought I saw something on the CAT scan, but I had only had the unit maybe a couple of months, so I wasn't real sure. So I sent it off to a radiologist. It was an MD, DDS. We got on the phone, and he said, "Oh no, there's nothing there." And who was I to argue with him? But I thought there was. 3 weeks later, she took the daughter to OU Dental School. By this time, there's a fistula, yay, on the second molar, okay? So my patients have 3 choices with an infection. You can do nothing, you can have a root canal done the first time or the second time, or you can have it extracted. She elected to have that second molar extracted. This is that tooth, and nothing shows up on digital x-rays or PA. This is the lesion. That's not a big lesion. When I first saw it, I thought, that can't be normal. That's a lesion. But, you know, the radiologist said, oh no, that's okay. Lessons learned. You can't be a little pregnant. It's either an infection and an abscess to me or it's not. Small lesions are still lesions. Sometimes that's easier said than done. So, you know, look at the other teeth on the same patient in your CAT scan, and sometimes it's okay to just not know. This, obviously a couple of root canal treated teeth. This is a great naturopathic physician, sent her out of state, sent her receptionist down. We did a CAT scan. We saw 3 root canal treated teeth. They all had small lesions. Gave her that information, and she went home. The physician called me, maybe 3 or 4 weeks, a month later, and she said, okay, Christine was her name, Christina. She's been in the emergency room twice in the last 2 weeks. She has symptoms that are like a stroke. The hospital says that they think she had a heart attack. Nothing shows up. Nobody knows what's going on with her. This was a 4-year naturopathic degreed woman. She was very bright. Other people have told me this naturopathic physician has treated over 3,000 cancer patients successfully. Bright gal, I had a lot of faith in her. She said, if you don't do something, she's probably not going to be alive in 60 days. So she came down and we took out those 3 teeth. The physician called me a week later and said, all the symptoms are gone. Okay. I did a little table clinic at the Dental Society meeting not long after that, and I was showing her CAT scan, and I talked with Dr. Tom Glass, who's a DDS, PhD in microbiology, teaches at the dental school and the medical school, and I told him the story, and I found it fascinating that he didn't blink an eye. He said, oh yeah, I get that. You know, name 4 or 5 bacteria that are in the mouth and could be an infection. He said, yeah, those end up in the circle of Willis and all kinds of things would happen. So I thought that was pretty interesting, because my experience has been the more educated people are and the more knowledgeable they are, the more understandable what they see and what we see happens. All right, this patient, sinus problems, low energy, and some of these later ones I just pulled out, you know, within the last 3 or 4 weeks. I didn't have to go back and look for weeks and weeks to find examples to show you. They show up every day. This is on our left. This was his right sinus, totally occluded. Now here's what I'm getting to. One, I could have, you'll see later as we go through the slides, there's going to be a lot of stuff like this. I mean, not big lesions. I actually had to blow this up. But I'm looking for the pregnancy. I'm looking for the small lesions. I could see the big lesions. And I believe it's either healthy or it's not. So here's a little radiolucency. This is looking from the axial view, and I'll show you later how we do that. And this patient had another, this is 19, obviously this is not related to the upper sinus. When I say that, it doesn't appear to be. This is a tangential view of the same thing. And there's nothing that says that the root canal has to fail down here, right? We've all seen that. All right, big lesion. So what? You'd pick this up on a traditional digital x-ray. However, virgin teeth on either side, patient is a naturopath, very aware of energy, great energy person. It was a cosmetic, an attractive woman. She wanted a replacement. She did not want a bridge. She did not want those other two teeth prepped. She was okay with an implant. Now, we'll talk about that later. I know there must be different opinions in this audience about implants, so I'll tell you what my experience has been. But at any rate, she wanted an implant. She had the knowledge and the training to be able to give me an intelligent answer. All right, you don't get this on a traditional digital x-ray. Okay, where's the bone? There is none. Looking at a cross-sectional view, this is real easy to see. All right, so there's no buccal bone. You have to decide if you need it. What are you going to do for this patient? If you do need it, yes, how are you going to preserve it? And we're not, I'm not going to get into whether or not to do bone, whatever, but at least it gives you the option to make those decisions. Now, you get information. All right, is this an abscess here? I don't really see one. Blow it up a little bit, you can think, oh, I don't know, is it? I don't see it. This is a 3D CAT scan. This, I don't see that this often, okay? But sometimes you'll see this. Sometimes you'll see this. What I sometimes tell patients when I'm going over the CAT scan, I say, let's pretend that this hand is your root of your tooth, and this is bone. Ought to look like this. If it looks like this, something caused that. So I want, and that's what we see a lot of times. This is a little bigger than what I would see without picking it up on the other film, but it does happen. What's the diagnosis here? Granted, this is not a good radiograph, and I can talk about that. And maybe in your office, you get perfect PAs every time, right? No, I don't in my office. So this was just so easy to see. All right, look at this. Again, not a big lesion. Look at the mucosal lining of the sinus. Is this a coincidence? I don't really know that this tooth is causing that, but it certainly looks suspicious. Look at this now from the axial view. See the sinus inflammation. Look at this around the root of the tooth. That's not normal. That's not healthy. That's an abscess in my book. A slight thickening of the periodontal membrane space. Don't really see something. Again, you guys can beat me up about the quality of the x-rays, but sometimes that's what I get. However, one of the points is the CAT scan, I mean, you strap their head in. It only takes 14 seconds. It's very rare to not get a very good CAT scan. That's an abscess. Look at this. Small abscess here. Look at the sinus. Is that an accident or is that unrelated? Probably not. Which is easier to diagnose. Little lesions here, or you look over here. Pretty easy. All right, this one you can pick up. Absolutely, you can pick that up on a digital x-ray. So this case isn't to show you that. It's to show you this. Okay, this patient had the same three choices: do nothing, root canal, extraction. Patient elected to have this tooth removed. I think I do a pretty good job of cleaning out the socket, and then I flush it with ozone. I have, in the past, I did a lot of Nico surgery. I've done surgery where I get into the mandible and I've moved the inferior alveolar bundle to one side and curetted around it. So it's not that I'm not capable of doing that, but I've got this tooth extracted. This is a small little lesion here. So this tells me, in this case, maybe I'm not going to curette quite as aggressively here as I would. Now maybe you would, and that's your choice. But it told me that I think I'm going to back off just a little bit on my curetting. Root canal treated teeth. Oh good, here we go. For me, this alone makes the cone beam essential. Okay, every year I get to go to for the last 5 years, I get to go to the National Finals Rodeo in Las Vegas. Started because a patient came in from out of state. Wonderful couple. He was a Vietnam veteran, a grunt, went back to San Diego, made $1 jillion in development, has had front row seats to the National Finals Rodeos for 20 years. 5 years ago, he said, I've got 2 tickets, you want to buy them? I said, and go with us, and we have, and we've been going for the last 5 years. All right, so this guy's getting ready to get on a bronking horse, and look at the guy's expression here. I mean, you know, I don't know who's more nervous. All right, here we go. Look like this is saddle bronc. They only have to stay on for 8 seconds. Okay? Here we go. Let's just pretend for a second that this horse is the root canal. And let's pretend that this person here is the patient. The guy here is the pickup rider. If this guy makes it 8 seconds, then the pickup rider comes along and helps him try to get off of that bucking horse safely. So you have to decide, who are we going to be? I really don't want to be that one. I don't want to be the person on that horse. I'd rather be the pickup guy trying to help him get off of that safely. I don't want to be this guy. It looked like this guy's about to get run over. I have believed root canals were often a problem. The difficulty for me is, how do I stay in the standard of care and still care? You know, I've done things that I knew in my gut was right to do, but occasionally and rarely I wasn't sure I had all the documentation that I wish I would have had. 2 years ago, I took an implant course from Russell Bears on the University of Chicago Dental School. In his course, he said he did research on the literature. There are 2 studies that he found. 10-year failure rate on one study was 35%, the other was 46%. 2 10-year studies. Anecdotally, every CAT scan, 3D CAT scan user that I've talked to says, oh, give me a break. We're talking 60 to 70% failures, and that's what I see. The nice thing is you can see it, the patients can see it. How often have we all heard, it never felt right, I've been to 2 dentists, they tell me they've taken x-rays, and it's okay. I've heard that a lot. This is fascinating. You guys see this article? August of last year. Those patients with 2 or more root canal treated teeth were more likely to have heart disease than those who reported no root canal treatment. Did you guys see that? I can't believe they published it. To me, this is the tip of the iceberg. That's pretty cool. So, x-rays, I'm old enough to remember back in the 70s we had the 70 kVp x-ray. My goodness, we could see incipient decay, and it was wonderful. But rightfully, we decided that we needed high-speed film, cut back the radiation, go digital, and it's not as easy to see things. But today, with a CAT scan, we can see small abscesses. Use the CAT scan like a microscope. I went through Capital University, and the president of Capital University was Dr. Ali, who was a pathologist for 30 years. And I did dark field microscopy and went to Germany and studied over there. But Dr. Ali would say, when you're using a microscope, you know, keep focusing in and out, keep focusing in and out. And do the same thing with the CAT scan. Continually scan in and out to view the image. Now, the first part of what I'm going to show you, they're going to be still slides, and you can't do that. But you know, before this is over, we'll pull up a CAT scan that we can see, and I'll show you how you can do that, and it blows your mind. Cancer patients. Why do I see this? And I told you earlier, I've seen 1 patient in 15 years who had cancer or a major illness that didn't have a lot of dentistry done. That's what I see. All right, look at the stuff here. It's small, and you guys can argue with that. What I want you to do is get your, all right, where'd we go here, guys? I hope that you'll look into getting a CAT scan, and you get to make those. Some of these decisions aren't easy. Same patient, that's easy. Same patient, that's easy. But I had to scroll in and out, like I told you, because we all know that if we're doing a traditional X-ray, we've got a block of bone and tooth this big. If there's a lot of dense bone on the buccal or the lingual, and we have a small lesion packed in the middle, it may not show up. I actually had to scroll in and out of this so I can see that. Did I just lose the mic? No? We're all right. All right, same patient. Look at the sinus membrane, small lesion, and look at this. There's some reaction to that. Floor of the sinus here is eroded. There's another one. Okay. I've only had a couple of patients that have showed up with biocalyx, and I'm not picking on biocalyx. I'm just showing you this is what I saw. This was 18 months ago. If we look at it in the axial view, we can see, that this guy's failing here, or never was successful. Look at it here. Look at the lesion here. Not again. I mean, how often do I see this? Look at the lesion. Look at this right out here. Okay. How often have we seen this? Patient said it never felt right. Digital X-ray, don't really see anything. Look at the bone here. Pretty big lesion, and that may be why it didn't show up very well. And there's also a small lesion at the apex there. And again, what I have seen and what I'm showing you is some of the small ones. I could have gone back and just picked up the great big ones, and you'd look at those and say, well, I can see those on my digital PA. Why would I want to spend $200,000 for this dumb thing? Small lesion down here. I was at an advanced course in radiology, and one of the oral surgeons or somebody there, we were looking at CAT scan. He said, "Oh, that's an apical scar. That's not pathology." I don't know what an apical scar is. Do you guys know what an apical scar is? Yeah, it's a granuloma. Yeah, I mean, it's silly. That's not healthy. All right, look at this. Look at the cortical plate. See how it's perforated right here? So here's an axial view. Now look at the cortical plate on this side. It's intact. Look at that right there. It's not. These are, you absolutely cannot find these with digital X-rays. And even with a 3D CAT scan, if you guys had one within a month, you'd be able to do this. You can look at these, but you can see things you just can't see anywhere else. Okay, look at the lesion here, and look at the lesions here, and look at the lesion here. Again, and you can see a little bit of root canal sealer out here. And again, you can see how we don't have the full side view of the tooth. That's because I'm moving in and out. Because I want to know if the bone and the tooth fit together like this. If they don't, then there's an issue. There's a problem there. Look at the little radiolucency to the side of this. Okay, this is a very close friend of mine. I'm not her dentist. She sees somebody else. She actually came by the office one day and I said, "Oh, let me do a CAT scan for you," and she let me do that. She is very traditionally minded, dentally and medically. She now has another root canal treated tooth. She now has been diagnosed with autoimmune disease, and she's 45 years old. I don't know that she's going to do anything about it. Doesn't hurt, she said. Look at this. This is the same patient. Look at the lesion on the distal root. See that? Looky here. The mesial root, they got 3 canals. You're thinking, You know, what I've seen is what I believe for a long time. I'm not sure, in my mind, in my opinion, that this is physiologically even possible. I mean, somebody really worked hard. I mean, holy cow, they got 3 canals in the mesial root, but guess what? We still have a failure here. This is another root canal. Treated tooth is a failure. Woman came in about 2 months ago, and right off the bat, I was taking her health history, and she happened to mention to me that she said, my daughter, who was 4 months old, died last year. And I wasn't trying to be a psychiatrist, but I put my hand on her arm and I said, are you still carrying guilt about that? And I'd forgotten. She looked at me and she smiled and she said, yeah, I'm dealing with it. I'm a psychiatrist. I found out later that she got the biochemistry award when she was in medical school. Very bright girl. She went back, did an autopsy on her 4-month-old child that's dead. She came to the conclusion that her child died because of excessive vaccinations. She's really gotten on the bandwagon. And now, you know how that happens. Now she's also interested in her own. So when she started opening up that door and that window, she found, like we have found, there's a whole world out there. So when she got interested in vaccinations, then she got interested in holistic health, and she, like a lot of us, I don't know about all of you, but I absolutely believe that the traditional medical model was the correct model 30 years ago, and it took some failures to find out maybe that's not it. Okay, here she is here. See the radiolucencies around those from an apical view? Same thing here. All right, this is a patient I think I saw last week. I mean, I could pull up every single patient I have. That's not true. 90% of the patients, I could show you something interesting on the CAT scan. So I don't even think a traditional dentist would think that you want to keep this. But it's real clear from the very beginning when you look at a cross-sectional view, it now lets you decide, okay, I've got some problems. We're going to take this tooth out. What do I want to do here? Do I want to do a bridge? Do I want to do an implant? Whatever. And everybody will decide for themselves what they want to do about that. But now you've got a little piece of the puzzle. This, you could do an implant if you wanted. But at any rate, you know before you go in what the issues are. Okay, how do I evaluate the CAT scan? Is there radiolucency? How big is it? How does it compare to other teeth in the same scan? Can I see it in other views? I mean, you know, same old, you know. I like more than one source, but sometimes you get one view that's so dramatic you think, this is it, this nailed it. How sick is the patient? How healthy do you want to be? I don't have a different criteria for root canal treated teeth. To me, they should look as healthy on the CAT scan as a non-treated tooth. Cancer patients, I see a lot of cancer patients in my practice, and again, I've seen one patient that didn't have a lot of dentistry. O'Muir's belief, we've talked about it, which is cancer is an infection that thrives in the presence of heavy metals. This patient that I'm going to show you, breast cancer, I think she came in just last month. Metastatic lesions already to the sternum. Look at the first molars. How would I treat this if this were my wife? I don't know. I don't think it's over. I don't care if she's got a metastatic lesion to the sternum. I don't think her life's over. Look at the lesions here. Again, you've got to look for them, but they're there. Look at that. You've got to look for them, but they're there. Surprise, surprise, root canal treated tooth. So again, everybody's going to have to decide if this were you or your wife, how would you treat it? I mean, some people would, oh, I had a patient in about a year ago, didn't really believe in what we do, drug in by sister-in-law, brain cancer, getting ready to go somewhere else. I called the physician and I said, we have some infections that were found on the CAT scan, and he said to me, almost verbatim, let's not bother. He only has 4 months to live. So, I mean, there will be those people out there that will say that. Actually, he would not let us treat him, this guy. He really never bought into this, and he didn't last 6 months. Went to Germany and did something, but still did not survive. How would you treat it? A lymphoma patient. Look at all this. Look at this. This is that same patient. Look at the lesions here. Look at the lesions there. This is a patient I'll talk about. This is the patient that we have, that I have, that we'll look at in depth. Uterine cancer. There. Results. I have seen amazing results when the oral cavity is treated as part of the problems. There is no guarantee. What would you do if it were you or your family member? Would you get rid of the infection? Would you try to improve the immune system? I don't treat cancer. Patients must be under the care of a health practitioner, and it can be a naturopath. And that's not for medical legal reasons. That's for me personally. That's just for me emotionally. You all can decide. And there's one, I've had one exception, and I'll talk about that when we do that. I treat oral infections, mental allergies. It is always the decisions of the patient. I believe most illness is an infection, immune breakdown, including cancer. Why do almost all cancer patients I see have extensive dentistry, mercury infections, root canals, metal crowns? One patient that I've seen. Best way to treat it, don't get it. Duh. Don't wait till the goat's down. So what does that mean to you? What that means to me is, I don't know about your practice, but I see these cancer patients and they come in, I see a lot of those. I don't know for sure how they come into my practice. And they're not coming in for me to treat their cancer. They're coming in because they found out there's a connection between their oral health and maybe cancer and their health. But why wait until they've already got it? What if we would get ourselves and our patients to do all this stuff first? This is kind of the view that we'll see from a CAT scan. Case planning, I think this is helpful. How are we doing on time? We're doing good. All right, this is see if I've got it, 50-year-old patient. She came in post-ortho. Anterior teeth were a little mobile, but I wasn't sure whether it was ortho or not. Everything's ugly. You can tell she's got some infections, got some problems. She wanted beautiful teeth, wanted a beautiful smile. She wanted full mouth reconstruction. Wanted to, hello. What do you think, guys? How many millimeters of bone is that? Looked like less than 1. So we're not going to go into how or why or what we would treat this. All I'm saying is the more you know to begin with, the easier it's going to make our life. In this case, what is this? Hopefully that's going to go away. It did. Was the bundle on top of the nerve? And yes, you can see here it is. All right, where's the third molar in this panoramic view? You really can't see it. But look at it over here. You might see if somebody's got another. Look at this right here. Look at the sinus. I've done at least 6,000 third molar extractions on young people. Today, would I do that? Today I wouldn't. I mean, any one of you out there could say, I just think the chances of that ending up in the middle of the sinus could wreck my morning or afternoon. It isn't, you know, it's not going to be life-threatening, but it, you know, all of a sudden now you're, you know, so all it tells me is beforehand, keep me out of trouble. Eagle syndrome, you know, it amazes me how many of those I see. 30–40% of the patients have calcified salamander ligaments. So, right, see if there's another laser pointer for me. Oh, you got one? If I try to get off of this thing, on top of the well, I've got one here. 10 days ago, we were working goats, and that means that you have to look at all their eyelids. You've got to trim all their feet. You've got to put them in the head gate, and some of them get turned around, and when they get turned around, you've got to force them to, you've got to pick them up and get them out. And about 4 of them got away, and they're on the ground. They're about 110 pounds, and they've got horns, and so I'm jumping on top of those with my son. I told him beforehand, I said, okay, I'm just going to watch. Right. So it took about 10 days for me to be able to walk. Normally I was afraid I was going to fall jumping off of that dumb thing. Oh, wow. Thank you. All right, tell you my theory on this. And this also goes back to Bob Marshall, PhD, biochemist that owns the Premier Research Lab. I think these are, at one time, they were osteoporotic. Or what happens is when the body becomes acidic, the body pulls minerals from the bone if it doesn't have enough in solution or available to buffer. And so when it pulls it out of the bone and gets it in solution, then it gets just deposited in different areas. And those will be your calculus formers, and those will be your Eagle syndrome. And it's you know, there's nothing I can do about it, but it's kind of cool to show your patients, and it kind of fits into our holistic approach with, oh, by the way, you were osteoporotic at one time, and da-da-da-da-da. My treatment is I use coral calcium plus aloe vera. You can have them check their saliva pH. There are other things we can do, but you know, today what I'm really trying to focus on is just this. I mean, all of us that are lecturing could lecture on a lot of different things, I'm sure. I see those all day long. All right, sinus and airway. It has, look at this, okay? And I think we'll be able to do it when I pull up the other one. I got real involved in sleep apnea or airway disturbances a long time ago, and kind of haven't done that in a while. So this is an area in my practice that's really underdeveloped, but it has the potential for you to look at the airway at this, because if you haven't put their front teeth together and you get your CAT scan and the airway's open, what is that? One of the things, it can tell you a lot of things. One thing it can tell you is maybe with an intraoral device you could open their airway. All right, here's a couple of our Clydesdales, and let's change direction for a second. Implants, this is why most people buy CAT scan. There's no question about it. You can do some amazing things with the with implants. You can instantly go in and look at the bone from a cross-sectional view, from axial view. You can drop a virtual implant into that place, see whether it will fit. You can map the inferior alveolar. You can look at the sinus. You can do all that in minutes, just seconds. Now, you may want to take more time later, but you can go back and you can do that at any time. You can plan implants quickly. You can decide to refer or not. You can order surgical stents. You can, in the future, connect to the CERAC, and what I'm waiting for is to be able to do a surgical stent on the CERAC, and they're telling me that that's really coming out pretty quickly. You can reduce implant inventory, because it's not a guesswork. You know, if you're placing implants, what size, diameter you're going to have. I've heard a young guy lecture twice, tells me that he schedules an implant patient 15 minutes. I've actually seen him do it. It took him a little over 15 minutes. That's with a surgical stent, because there's no flap. Put the surgical stent in, zip, zip, zip. I've placed about 5 zirconium implants in the last, I don't know, 3 or 4 months. We can talk, but that's not what this is about. This is a little bit of, you can make the surgical stents. First couple times we ordered those from Germany, it was ugly. I mean, I don't know why, you know, a lot of those things you think it's going to be simple, and there was something we were missing, but one of the things we figured out is you can do just a bite registration inside. You get this guide that comes from Sirona, and then you have to attach that to the teeth, and then you put that in and take a CAT scan, so that then you can measure things. And this is one that we did with a zirconium implant on an anterior, and it really helped because, you know, could I have done it without? You know, probably, but it makes it so simple. I mean, boom, you know exactly what angle it's going to be. So you can do some virtual planning. It's really interesting. It's going to evolve. It's going to get better. This is one of our patients that came in. We decided together that we were going to do an extraction on that tooth. So she shows up in the office and she says, "Oh, by the way, can you put an implant in today?" It was not scheduled, but I mean, look at this. I mean, how difficult is that? There's, you know, the nerve's way down here, plenty of room, not a lot of infection. I did that one. I don't do that very often, but I mean, it has some amazing ability. From, if you decide that implants are something that work for you philosophically, strongly recommend that you get a 3D CAT scan to decide. Don't do all of them. Just do the slam dunks. Do the easy ones. Send the tough ones out to your oral surgeon or somebody else. Where's the bone? Where's the nerve? Alignment of the opposing tooth. Yeah, we did an implant that day. Lessons learned from a clinician rancher, and I'm at heart a simple goat herder and rancher, but I love all this stuff. Very ill patients. I've told you this over and over and over. I've only seen one patient with cancer who had very little dentistry, almost none. We're at the start of new technology. If this fits your hedgehog concept, get ahead of the curve. Don't wait till you're the last person on the block to do it. What do the small lesions mean? I sometimes feel like Madame Curie. I mean, this is, I've not seen anything like this since I've been in practice technologically. I mean, I'm seeing things that nobody knows what means, so I'm trying to figure them out. But this technology is fascinating. Very ill patients, I think we need to be more aggressive about what we do for them. Early diagnosis. The CAT scan is a great tool for early detection. Let us see low-grade chronic infections of long-standing. Most lesions are asymptomatic. Most patients do not even know they're there. Like the goats, catch it early. Helps in case planning, implant planning. Wows the patient. It financially creates an amazing amount of dentistry. What's the difference between early detection and prevention? Just time. For me, it's still a moral issue. Early dental detection can be a systemic prevention. Financial, just tell you it'll create dentistry that you won't believe. When I was overseas, I walked into 101st Airborne Camp. No hawks, no doves, all eagles. Most of you don't even know what that means. But we're beginning to see that again. The people that want into the conflict and out. But what this really means, what this meant to the 101st Airborne, to this unit, is don't get distracted. We have a mission to accomplish, and let's just be eagles. And I firmly believe that this organization stands for that. There are a lot of distractions out there, but I see this organization being in the forefront of staying focused, taking care of our patients. So that's my wife and I at the ranch, and if you're in Oklahoma, come by and see us, and we'll give you a ride or put you to work or do something. How are we doing time-wise? Are we out? Okay, cool.